Welcome to the Speech and Language Therapy Department's Voice Information Session, Part 2. How can I help my voice? Well, there are 4 main areas that we look at to improve voice. Good voice care, that is the do's and don'ts of looking after your voice. Practicing good voice care will give you a practical starting point to helping your voice. Relaxation. This is good for our overall health and well-being, and targeted relaxation exercises help to physically reduce tension in the throat, so helping to improve voice quality. A healthy, effective breathing pattern and good breath support help to power the vocal cords without undue strain, and this gives the voice stamina, quality, and control. This may be something that we look at in voice therapy if required. Finally, specific voicing exercises may be needed, which would be looked at in one-to-one therapy sessions. A voice therapist will select which are appropriate for you. The environment at home, at work, or out and about can have an impact on your voice. Try to minimize your exposure to smoke or dust in any situation. Think about ventilation, keeping windows open. If you're dusting, use a damp cloth, and avoid environments where people are smoking or vaping. Keeping the air slightly moist by opening windows, keeping houseplants or a bowl of water near a radiator can help in your home. Talking over background noise can be fatiguing for your voice. In an office space, consider the use of sound barriers or headsets or a voice amplifier. The use of good communication strategies can help where you are talking over background noise or speaking to someone who has a hearing impairment. Be face-to-face when speaking. Use visual or sound cues, and speak clearly, not more loudly. Medical factors may also impact on your voice. If you use an inhaler, use a spacer. Rinse or gargle or drink some water after using it. If you have reflux, that's acid indigestion, avoid spicy or acidic foods, especially at night. Sleep in an upright position, and speak to your GP if you haven't already been prescribed an antacid medication. If you have a sore throat or a tired voice, limit your voice use. Sip warm liquids or suck a sweet, or perhaps try a steam inhalation. Behavior and lifestyle can also impact on your voice. Avoid throat clearing or coughing where possible. Try to trigger a hard swallow or sip water. Sometimes very cold, fizzy water might be a help. If you had a cough for more than 3 weeks, please ask advice of your GP. With regard to diet, try to cut down on dairy products. Drink less caffeine and alcohol, as all of these things can dry the throat and thicken mucus. With regard to voice use, avoid shouting and avoid whispering. Speak gently, especially if your voice is tired, and perhaps consider a voice amplifier. Keeping hydrated is very important. Drink plenty of water. This will keep your vocal cords hydrated and much better able to cope with vocal demand. And very importantly, please avoid smoking or vaping. Stress and anxiety can also impact on our voices. Where possible, try to identify what is a stress factor for you and try to reduce stress in your life. Relax. Identify things that help you relax. That's different for everybody. And talk. If things are difficult, try to talk to somebody. I hope this presentation has been helpful for you and has given you some things to consider that might be impacting on your voice and helped you start to think about what things you might be able to change. You may now feel that you have enough knowledge to improve your voice on your own, or you may still have concerns about your voice. In that case, you might need a course of voice therapy. We can discuss that in our phone or video consultation. The role of the voice therapist is to help identify the underlying causes of the voice disorder and address those along with specific breathing, voicing, or phonation exercises. Voice therapy can be challenging because, like any exercise program, you need to practice on your own and be motivated to make changes. It's your voice, and if you want to change it, you'll have to work at it. You need to attend voice therapy, if that's appropriate for you, with an open mind, with commitment, and believe in what you're trying to achieve. If you do that, you should succeed. Now you've watched both parts of our voice information session, please refer to your letter for next steps. Thank you.